The problem is that when you need medicine, when you need medical help, is a wrong time to think about medicine because you're in such a vulnerable state at that time that you cannot rationalize what is good for you and what is not good for you. If you don't have proper regulations, if you don't have qualified regulators, if we don't address those systemic issues, what is the point of saying your state didn't do this, my state didn't do this, that other person's state didn't do this, you point this, and then you go arrest the doctor. What is the doctor going to do? The doctor relies on the fact that the government's supposed to ensure the quality of the drug and our drug supply. It's very interesting that you actually say this, right? So Madhya Pradesh Chief Minister has basically said that it's the responsibility of the Tamil Nadu government because they didn't regulate their manufacturer, and that's the reason why, people died in Madhya Pradesh, right? That is basically the gist of his conversation, right? Just today, I sent a letter to the health minister, Mr. Nadda. There is an incident of contaminated mannitol in AIMS, All Indian Institute of Medical Sciences, in September. And where the manufacturer is located? In Madhya Pradesh. We have passed an act in Parliament called the Jan Vishwas Act. This act decriminalizes first offences if you are convicted of making a bad quality drug.
The death of 20 children in Madhya Pradesh is a shocking news, but not something that has really shocked a lot of people who have covered health or who know a thing or two about India's health industry and India's drug control. We've seen how the government in Madhya Pradesh reacted, how the central government reacted. Initially, when the response came, we were told that there is no issue, whether it was because of authorities that looked the other way, whether it was because of poor drug control, or it was just doctors who were giving children the wrong medicines. We don't know. But what we are very certain about is that this is something that has not happened for the first time. Now, joining me to discuss this and more is Mr. Dinesh Thakur, who is a public health activist. You're known as the Ranbaxy whistleblower most popularly. Thank you, Mr. Thakur. Welcome to The Wire. Now, I want to begin this interview by asking you, we have seen how things have unfolded in Madhya Pradesh and how these 20 children died. Was this news shocking and surprising for you?
Well, the death of children always is saddening and shocking, but surprising? No. It isn't surprising at all. In fact, I remember writing to the health minister in 2020, I think 22, basically asking for the ministry to do something to investigate what had happened in Jammu at that time, which was a similar incident with children had died at that time.
12 children had died in Jammu, yeah.
And so to asking him to basically investigate and make sure that we put in place proper procedures and controls that these kind of things don't happen, but never heard back from the ministry or the drug regulator. So it's of no surprise that it's unfortunate that you have to, again, spend so much time, talking about deaths of children.
Exactly. The reason I ask if this is shocking for you is because this is not a first. We saw this happen in Gambia in 2023 when the Gambian authorities accused India, in fact, of not regulating their drugs properly. And 70 children had died in Gambia, but the government took no responsibility at the time. We also, as you mentioned, the Jammu incident, then there were accusations when something similar happened in Uzbekistan. And later, now, when this tragedy unfolded in Madhya Pradesh, the initial response was of denial. But when the Tamil Nadu government, they came out with this report that there was indeed contamination with DEG, then things started moving at a very quick pace. As somebody who's very familiar and acquainted with how things work in this sector and industry, could you tell our audience how exactly such a tragedy unfolds and was it preventable?
So, if you go back and actually look at the responsible manufacturers, so India has now had, this is a 9th such incident, right? Between 1972 and 2025, we've had 9 incidents so far. Started in Madras.
Just of DEG
poisoning. Starting in Madras with 15 children, then with in Bombay with the JJ hospital, then we've had one in Gurgaon here, in Delhi, Jammu, right? I mean, so this is the ninth incident within India, right? So if you look at the manufacturers who were identified as being responsible for making a product that led to this kind of mishap, right? And if you look at, the industry likes to segregate itself as big pharma, right? The big brand names. Then you have the small and medium pharma, right? In the country, because the way that the government looks at big pharma and small and medium pharma is very different. All of these companies fall within the small and medium pharma, right? So then you have to ask the question: why is it that a product made by a small or a medium pharma is often the culprit when these kinds of incidents happen? It's not as if the large companies don't make cough syrup, right? First of all, there's a lot of discussion on the fact that should you even give cough syrup to children, because it's only symptomatic relief, right? It's you're not curing the ailment behind what's causing the cough. You're essentially basically trying to sedate the kid and provide some symptomatic relief with cough. That's typically what happens when the winter sets in right about now.
In fact, the WHO says that children should not be given these kinds of cough syrups.
Correct. But the problem with that statement, Alishan, is that our air quality has degraded significantly, right?
Right.
Respiratory diseases, which we didn't have as many like 10, 15 years ago, have become the norm right now. Just wait, Diwali is coming. You see the quality of air, what's going to happen to us in about 10, 15 days from now. Because of the problems that we have with our air quality, there is a rise in respiratory diseases. And one of the symptoms when you have an infection like that is you have cough. And if you have children, young children, right, whose bodies are really small, and they're administered this cough syrup that's, in many of all of the 9 incidents was adulterated with diethylene glycol, their kidneys are unable to process that. That's how, their kidneys shut down, they die. My point I'm trying to make here is that this is not unique. We've had many instances to learn from, to try and correct it. As recent as Jammu is not even like 4 years ago. Gambia is just about 2.5 years ago, right? Gambia, Uzbekistan, Cameroon, they were all linked to India.
Mr. Thakur, so what you are suggesting is that this is a problem of regulation, one, and also something that's very hard to tackle because of the changing environment, because cough syrups are now being produced at scale. I mean, I was reading how cough syrups like Cold Riff and all these cough syrups, there's a hike in the production in recent years.
Right.
I saw this tweet from Dr. Kafil Khan, and in which he basically asked people whether they are aware of these cough syrups and whether they give these cough syrups to their children.
Right.
The replies to this tweet, they were quite shocking, because most parents, they said that we really did not know that this is toxic, and some even said that this was prescribed by the doctor.
Correct.
So, as somebody who really knows how this works, can you tell me, how can somebody like me, who really does not know anything about medicine, or who does not know whether to, if a doctor tells me to consume something, I will do that. I'll take that as a treatment.
Correct.
So why are these cough syrups and these products that can be toxic to children and that can be toxic to so many people available so easily?
Let me just turn the question around and ask you a different question, right? So let's assume that you had to take one of your relatives to a hospital, and the hospital and the doctor gave you some medicine, right? It didn't have to be cough syrup, could be something completely different, maybe diabetic, maybe hypertension or something like that. Would you question that the doctor, why is he writing that particular medicine? Right? You won't, right? And the reason for that is because we trust that system to function. We trust the fact that the doctor is a qualified person, and that person is prescribing this medicine after examining you or me, whoever it is that's gone to that doctor, right? To basically to say that the prescription that the doctor is writing, you trust that that's going to help you, right? It's the same thing that we're talking about when you talk about cough syrups with children. Parents who have their children, with upper respiratory infection, they go to the doctor and basically say, okay, look, we have, a problem with our child who's coughing. Could you please give him something to at least provide symptomatic relief of that? The question is not just that the parents need to know everything about the drug that is being administered. Where we really need to ask the question is, how do you trust the system, the regulatory system that actually puts this product in the market?
Mr. Thakur, the reason I asked this question is because of this. This was a press release by the government that really said that you need to be, and people who are delivering these drugs, and they need to be aware of the ingredients of these drugs. So what is then the role of the authority that is going to regulate these drugs?
That's the reason why you and me as taxpayers, we finance the salaries of the regulator with the expectation that these medicines that are available when you go to the chemist shop to buy these medicines are supposed to be safe and effective, right? That is the whole point of having a drug regulator in place.
And why should, Mr. Thakur, my question is, why should a doctor exactly know this? If the government is giving, if the government is allowing this drug, the doctor should trust the government. I would trust my government that this drug is okay, and this government is my government is allowing this drug, so I can give it to my patients.
So listen, I think that drugs, like any other product, right, will have some defects. There is no 100% product that is quality, 100% quality. There's always going to be some defect. You go buy a car, sometimes cars have defects, right? Then you take them back to the shop, they fix it. You buy a cell phone, sometimes the cell phone doesn't work, right? You go back to the shop and they'll try and play with your SIM and figure out what is wrong with it, and you get the signal back. Just like that, drugs also have defects.
But Mr. Thakur, there's a very slight difference here. If I'm buying a car, I can figure out that the car is defective. Correct. I can figure out that my food is defective. But when I look at a medicine pill, I would not be able to do that.
And the expectation that the government has that as citizens who are not qualified to practice medicine, that we ought to understand what is good quality medicine and what is not good quality medicines, that's a misplaced responsibility, right?
Even whether it's a bridge collapsing, you find easy scapegoats, and whether it's these children dying in Madhya Pradesh, you also go for easy scapegoats. We saw that they went after the doctor initially, then there was a pushback by the IMA. Is this a problem at the level of the society or at the level of our government, that every time such a crisis unfolds, we want to show something to the people and then the conversation just ends for once and all?
The parents have lost their children, right? I mean, obviously they're outraged and they want to take that outrage out on somebody. I can understand very clearly the outrage that is being expressed by parents who lost their children, right? Absolutely. You understand that. What I cannot comprehend is for the government to put out a press release basically saying that we have done, I mean, if you read that press release that you're looking at, the DGS, it talks about risk-based, it says that we are conducting risk-based inspections. And it says that, we have already identified, we already know that DG is not a cause of this, right? On what basis did they put this out? Where was the testing done at this time? Because Madhya Pradesh's testing report came a day after Tamil Nadu's report. Tamil Nadu's report came first, and then came the MP report, right? At the time that they actually put this out, the MP report, one of the reporters actually has put out this in public, the MP testing report. That is dated October the 2nd. What was the date of this press release? It's October the 3rd. So on October the 3rd, the government knew that MP had already identified diethylene glycol to be a culprit in this situation. And yet, they're saying in this press release that we've determined that DG is not a cause. How do you reconcile this now?
And then they backtracked.
Of course they backtracked because Tamil Nadu called their bluff. Tamil Nadu called their bluff and told them, no, it is a problem with it because we found 48% diethylene glycol in it, right? Once their bluff was called, obviously they had to backtrack. My question is, why does the government feel so compelled to lie to its own people? What was wrong in actually saying, you know what, we are very sorry that this happened. We are investigating it. Give us a couple of days. Let us complete the investigation. We'll come back to you with our report. What is wrong in saying that?
I mean, to my mind, these are just excuses. If you look at the United States, the last time a child died due to DEG poisoning was in 1937, and the US made sure that no child dies after that. And in the last uh, 9 decades, no child has died, in fact. But for a country like India, where something like this is quite cyclic, what is it really that we need to do, our government needs to do, and as citizens, we need to do?
Since you brought up the US issue, right? Let me also tell you that there are a number of cough syrup products sold over the counter in the United States. NyQuil and DayQuil that are made by Richardson Vicks are cough syrups. They are sold over the counter. कि ऐसी बात नहीं है कि यूएस में ना कॉफ सिरप नहीं बिकते हैं बट क्वालिटी का इश्यू है वहां पे, राइट? आप जिस बात के the thing that you're asking is why is it so different here in our country? The reason is very simple, because we don't have, or we do not have a regulatory framework and an honest regulator to regulate what we're being sold in the markets. It's as simple as that. Same thing happened in the Gambian situation, right? Just like this time, the government actually put out a press release trying to mislead people. If you go back and look at what happened, at the time that the WHO put out a medical alert when the children's death actually happened, there were 66 children at that point in time.
70, in fact,
there were more deaths after that release. But the first response to the DCGI, if you read the letter, it is full of hubris and it's full of this Vishwaguru nonsense, basically saying, how dare you question our product?
I think there's also this issue where the Indian government, whenever they are questioned on these issues, even in this tragedy, you'll see somebody who's saying that there are threads on social media where they're saying that, it's being turned into an issue that's the central government is not responsible for it at all. It's the Tamil Nadu government, in fact, that should have stopped this crisis. But it's not. I mean, we clearly know that it's not just Tamil Nadu. It's something that both the center and the state are responsible for. So we always see somebody passing the blame onto somebody else. And in such a situation, how can somebody reconcile with facts when you always have this constant state where nobody is responsible for anything?
It's very interesting that you actually say this, right? So Madhya Pradesh Chief Minister has basically said that it's the responsibility of the Tamil Nadu government because they didn't regulate, their manufacturer, and that's the reason why, people died in Madhya Pradesh, right? That is basically the gist of his conversation, right? Just today, I sent a letter to the Health Minister, Mr. Nadda. There is an incident of contaminated mannitol in AIIMS, All Indian Institute of Medical Sciences, in September. And where the manufacturer is located? In Madhya Pradesh. Unfortunately, no one's died so far. AIIMS has found out that the injections that they give of mannitol to the patients actually has fungus in it. Okay? This has not been an issue because we have so many of these incidents actually happen where you don't have mass casualties like 10, 12, 15 children dying, right? AIIMS found that out. They put out a press release, and the manufacturer of that particular, parental injection is a company based in Madhya Pradesh. Now, shall I ask the Madhya Pradesh Chief Minister, why is it that you haven't done enough? Because your company in your jurisdiction is producing bad quality drug? What is the point of doing this?
In fact, it's not just a problem with Tamil Nadu or Madhya Pradesh. If you look at Rajasthan, I want to point this case. In just last 2 years, a company that was flagged 40 times, 40 times their samples turned out to be contaminated with DEG. It's a company called Kansas, I suppose. And this company was a part of the Mukhyamantri Nishulk Dawa Yojana, which means that
government procurement.
Government procurement. It was easily available to common citizens, and it was available at scale. So it's something that's like quite rampant. So you can make the same argument against the Rajasthan government in that case.
So in this issue, there are two aspects of it, right? One is the control of the manufacturing process, so you don't have a bad quality product in the market. That's one big aspect of it. The second aspect is procurement at the state level. Remember, state is largely a health subject on the concurrent list, right, of the Indian Constitution. Most public health is administered by states, right? If you look at public procurement at the state level, it is essentially a patronage. The reason why many of the smaller to medium enterprises survive is because they have the ability to influence the state government to buy medicine from them without any understanding of quality at all. I mean, Madhya Pradesh government has bought drugs that has been blacklisted by the CDSU and Center. How is that even possible? Don't you, when you put out a public tender, don't you even look whether the company that's actually providing a tender to you, responding to your tender, has it been blacklisted anywhere in the country? The reason I'm saying this is because we have systemic issues. We have a problem in public procurement. We have a problem with drug manufacturing. Right? So these are two systemic issues we have to address. Just saying Madhya Pradesh didn't do this, Tamil Nadu didn't do that, some other company, West Bengal had this issue with the ringer lactate solution 6 months ago. Every state has the same problem,
It basically turns into a debate of your government
versus my government. Yeah. And what do we gain? What do we gain from that discussion? All we do is muddy the water, and 2 years down the road, a similar situation happens again. Unfortunately, more children, succumb to this nonsense, and we do the same nonsense again. We did the same thing with Jammu, right? We did it not that long ago when children died in Jammu. We created the same nonsense. Digital Vision, the company that was based in Himachal.
The person is out on bail.
On bail right now. So what exactly have you done? What is the deterrent? 2023, we have passed an act in Parliament called the Jan Vishwas Act. This act decriminalizes first offenses if you are convicted of making a bad quality drug. Prior to this, you had a 2-year minimum jail sentence if you were convicted of making a poor quality drug.
Since you mentioned this, I was reading a press statement, and a BJP leader pointed out how this Food Safety Drug Control Department of Rajasthan, they've changed the definition of the Drugs and Cosmetics Act 1940 to protect the guilty companies. So even if 0% of the active ingredient is present, it can still be classified as a correct drug.
So my point is this, right? If you don't have proper regulations, if you don't have qualified regulators, if we don't address those systemic issues, what is the point of saying your state didn't do this, my state didn't do this, the other person's state didn't do this, you point this, and then you go arrest the doctor. What is the doctor going to do? The doctor relies on the fact the government is supposed to ensure the quality of the drug and our drug supply. Doctor doesn't have the wherewithal or means to actually test that particular batch of the product out there in the market. Doctor is not going to be able to do that. Right. What happened in AIIMS? The best doctors in the country practiced there, right? They saw this contamination in mannitol with fungus in injectable. The root cause is our drug regulation. The root cause is our drug regulators.
It's said that India is the pharmaceutical capital of the world. We do supply to a lot of countries. For certain countries, the standards, in fact, their own standards are so high that we have to maintain those standards. But for countries in Africa and even for India's own citizens, what is our government doing, and how are we ensuring that these standards are met?
That's a good question. So one of the things that has happened was 2 years ago, last year actually, the government had upgraded what is called Schedule M. It's in the our Drugs and Cosmetics Act. It's the equivalent of the good manufacturing practices in Europe and United States. This was done after a long period of giving free hand to the industry. Even now, right, when the regulator made it mandatory, the small and medium enterprises lobby group went back and basically said that we don't have the wherewithal to actually meet all of these regulations. Give us 2 more additional years, and government should actually, give us more money to be able to do that. This is the power of the pharmaceutical lobby. This is what has happened. And if you don't have proper controls in place, if you do not have one of the primary issues that we have in drug manufacturing is if you buy a raw material from somebody, right? In this particular case, propylene glycol, which is used to make cough syrup. The requirement is that you test that before you formulate your product.
It's also an industrial chemical.
Propylene glycol is used, and the regulation requirement is that any manufacturer that actually buys propylene glycol from the market and uses it to make medicine, they have to test that first.
Right.
And make sure that it is of a certain purity and quality standard.
In fact, they cannot buy it from the open market. They have to buy it.
Grade,
they have to buy a pharmaceutical grade chemical. Yeah.
You have to ensure that these people are doing that testing, right? If the regulator, which is by law required to conduct inspections once in every 2 years, and our regulator does not make the results of their inspections public.
Right. Mr. Thakur, isn't this also because we do not have enough regulators? We do not have enough drug inspectors. We do not have, even in states like Tamil Nadu, the hirings are not as much as they should be, but in places like Bihar and UP, they're in fact even less. So is that also because we are not doing enough for quality control?
Health actually is never on anybody's radar, to be very honest with you. Look at the standard of our public health services in any of the Hindi belt. Bihar, Chhattisgarh, Madhya Pradesh, Uttar Pradesh. Go look at, what does the primary healthcare center look like?
I think last week, a dead body was found in a public water tank in a hospital. And it was rotting there for weeks and weeks. Whether it's a murder or it's suicide, that's a different question. But people were in fact having water from the tap.
My point is that health is not on anybody's radar. And unfortunately, what happens is health becomes an issue when you need it, right? We saw this in COVID, right? People who never bothered about understanding what Mohalla Clinic was, and they had an opinion about what Mohalla Clinic was. During COVID, they all went to the Mohalla Clinic trying to get medicine, right? Unfortunately, the problem is that when you need medicine, when you need medical help, is a wrong time to think about medicine because you're in such a vulnerable state at that time that you cannot rationalize what is good for you and what is not good for you. You have to rely on the advice and the judgment of the trained medical professional to be able to help you. Unfortunately, when you go to one of these public health centers in the Hindi belt, there aren't even, forget doctors, there aren't even nurses or paramedical staff who understand what needs to get done. And these poor people take buses to go to a city, to a large hospital, which is crowded like crazy. It's not adequately staffed.
In fact, there's, I think, no tertiary healthcare in most second-tier cities in India, especially in North India.
So you're asking me, why don't we have enough drug regulators? We don't have enough doctors. We don't have enough nurses. We don't have equipment in our primary health centers to do basic sort of health checkups for people. We don't have drug regulators. We don't have money to give the drug regulators to sample products from the market. You know what's different in India versus other countries? In other countries, they think about quality as built into the process. So every step in the process has a quality parameter. In our law, we measure quality by buying a product from the market and testing it in the drug lab. By the time you test in the drug lab and find out it's the bad quality products, hundreds and thousands and lakhs of people already taken that. That is the way that we measure quality. And these poor drug inspectors, how much money they actually get? 40,000 rupees per year to buy medicines from the market. How much? What medicine are you going to buy for 40,000 rupees? Will you buy cancer medicine?
So, Mr. Thakur, my last question to you. As you said, we are not bothered as a society, and if it doesn't become an electoral issue, it won't bother the politicians. What can we do as a society to, at least bring about basic changes? And it is like you're just one emergency or one, this crisis that unfolded in Madhya Pradesh, it would have happened with anybody around us or to anybody we know.
The best advice I can give you is educate yourself, right? If you wait until you need medical help, it's too late for you to understand how the medical system works. how the health system works. I mean, 2 years ago, we wrote this book, primarily to try and get people to think about, what is drug regulation in the country. I'm hoping that people can buy it and read it and understand exactly how the health systems works in the country, how drug regulation works in the country. Educate yourself and then start asking questions of your elected MPs and MLAs and say, look, why isn't my healthcare primary health center doesn't have a doctor coming in at least 2 times a week? Why isn't there the nursing staff available there? Why isn't the blood pressure medicine machine doesn't work for me to be able to, get basic stuff done, right? Blood sugar for diabetics, blood pressure, for hypertension, We should be able to do all of this stuff with primary health care. And then if you don't ask for this, no one's going to care. Right? We have to educate ourselves. That's the only way to try and make any difference.
So thank you, Mr. Thakur. Please subscribe and keep the independent journalism free.